One-stop shop anaemia clinic. A one-stop shop anaemia clinic offers both appointment and treatment on the same day at the hospital. This prevents delays to helping you feel better quicker. This short video shows you what will happen on the day, who will be involved in your care, and how soon you can leave after your visit. To understand your condition and treatment options, let us start by explaining what anemia is. Anemia is a condition caused by lack of red blood cells or hemoglobin. Hemoglobin is a protein found in red blood cells that transports and delivers oxygen to the body's organs and tissues. Without enough hemoglobin in the body, you can feel tired, breathless and dizzy, especially when moving around. In the UK, the most common reason for developing anemia is not having enough iron to make hemoglobin. One source of iron is your diet.
Dietitians provide evidence-based advice to patients to support them with their treatment and management. We would see patients who need more specific tailored advice regarding increasing their iron in the diet. For example, a patient who's vegetarian or vegan and perhaps has a poor appetite and is struggling to increase heme sources of iron in the diet, so we might look at other ways of increasing their iron intake. We're able to see patients on 2 North A, and we also sit in specific clinics where we can pick up referrals. If you don't necessarily need to see a dietitian at present but would like a little bit of general advice on increasing iron in the diet, the British Dietetic Association Food Fact Sheet is a really useful resource that can be accessed online through the following link.
We are now going to follow the journey of a patient coming to the hospital. If your GP decides you have an anemia that requires specialist treatment, they will refer you to a hospital. A hospital visit means a clinic appointment with a haematology doctor. Before the day of your visit to the hospital, you will receive by post an appointment letter and an information leaflet explaining what anemia is and how we might treat it. Please bring your letter on the day of your visit and read the information leaflet to help understand what will happen on the day.
Hi, I'm the Clinical Pathway Administrator. Part of my role is to help patients prepare for their clinic appointment. For example, I send appointment letters and arrange bloods to be done. If patients have any queries or they require any support, they can contact me on the phone.
Remember, if same-day treatment is offered to you, then allow 3 to 5 hours for your visit. You can also bring a friend, relative or carer to sit with you throughout your visit. Blood tests may be required on the day. These are taken in the phlebotomy room on the ground floor. If you have been asked to have blood tests taken, please do so before your appointment so that the doctor can check your results when they see you. Sometimes blood tests may also be taken following your appointment.
Hello, I'm a phlebotomist. My role is to take right samples from right patients. I check blood samples, match patient details. You might see me if you come to the blood test room.
I'm a haematology doctor, and that means I look after patients who have problems with their blood. There are a lot of different things that can happen with people's blood, but today we will be talking about the problem of anemia.
When you arrive for your clinic appointment, check in and take a seat. The doctor will call you over once they are ready. If you need help or assistance, please ask staff at reception.
My job is a clinical receptionist, works for the outpatient department. My role is to check in patients, verify their appointments on the clinic, and then tell them to have a seat. If there's any issues or problems, they know to come back to me.
The doctor will review your blood test results and ask you questions about how you are feeling.
Good morning, is it Jenny?
Yes, that's right.
Hello, my name's Derrylyn Hughes. I'm one of the consultants here in the anaemia clinic, and your GP has referred you because your blood levels are a little low. Is that what you expected today?
Yes.
Okay. So can you tell me what the main problems have been for you?
I've been feeling very tired lately and also getting a little bit out of breath. For example, if I have to run for the bus or if I have to climb up the stairs, feeling very out of breath and just feeling tired and run down.
Okay. And can you tell me, have you noticed any other symptoms where you might have been losing blood from anywhere? So any nosebleeds or bleeding from anywhere else?
No.
Okay.
The doctor will decide if you should have same-day treatment. If you have an iron deficiency, the treatment is usually a short 30-minute iron infusion. This would take place on the ward. This patient information leaflet explains what an iron infusion is for, how it is given, and how we will monitor you. Please read it to help understand what will happen. If you have agreed to an iron infusion, tell the doctor if you have any history of asthma, eczema, or other allergies, or have ever had a reaction to any type of iron injection or infusion in the past. You may wish to ask the doctor, how long will the iron infusion take? Can I have the infusion on another day? When do I stop taking my iron tablets? Once the doctor decides an IV iron infusion is necessary, they will prescribe this, and the haematology clinical nurse specialist will make the arrangements on the day ward for your infusion.
I am a pharmacist, and part of my role involves checking your intravenous iron prescriptions. A few of the things I look out for include your weight, your iron levels, and your allergy status. You may see me on 2 North A, as that is where I am based.
Hi, I'm a clinical nurse specialist for hematology. My role is to provide information to patients and carers. I also organize your iron infusion. You might meet me when you come to the clinic for the first time, or if you need any support during your visit.
Upon arriving on the day ward, identify yourself to staff on reception.
Please put this underneath your tongue.
An IV iron infusion involves having a small needle inserted into your arm, through which iron will enter into your bloodstream. We will monitor you during the infusion for any signs of a reaction to the infusion. It takes around 30 minutes to complete, and once it has finished, you are free to go. You may need a further iron infusion on a different day to ensure you receive the correct dose. The doctor will arrange this. Please contact the haematology department to speak to your doctor if you have any questions about your visit. For questions about this video or further information, contact the Royal Free Haematology Department.